Good afternoon. Good afternoon, everybody. Good afternoon. I would like to start the meeting. We have a very full agenda, and we don't have all that much time. And I want to be respectful of other people's time, so we'll start, and those that come in, hopefully they come in quietly and find a place to seat. My name is Charlotte McLean-Intlapo. I'm the Global Disability Advisor for the World Bank Group. And I'm really absolutely thrilled and privileged to have been asked by this group, the Nordic region, to speak and be the moderator for an event on statistics for monitoring the implementation of the CRPD and the SDGs in the Nordic region. This side event is organized by the Norwegian Ministry of Children and Equality, the Norwegian Directorate for Children, Youth and Family Affairs, the Nordic Council of Ministers, and the Nordic Welfare Center. So thank you very much for stepping up and for arranging this. I'm also told that this is the first of its kind. And so this is an exciting coming together of the Nordics at the Conference of State Parties to discuss a very important issue. Now, many of us were in the opening session this morning, and some of us were here yesterday at the Civil Society Forum. And one of the issues that kept on coming up was the issue around the huge data deficits that exist, and that these data deficits or data gaps exist at a global level. But we also know that many countries collect some kind of data. It may be administrative data, it may be different types of data, but it's not systematic, it's not data that's comparable. And so even where we do see little pockets of data collection, it's not necessarily data that can be used to inform policy and or to support implementation of the Convention on the Rights of Persons with Disabilities. And the idea of the data deficit is not a new one. During the negotiations of the CRPD, there was a lot of discussion around data. And that's why we now have Article 31 in the Convention on the Rights of Persons with Disabilities that speaks to the issue of statistics and data collection. There's been a lot of discussion more recently about what tools can we use to collect the data. And again, both yesterday and in today's plenary, there was a very clarion call to say that there are methodologies that exist, and one methodology that has been tried and tested is the Washington Group. And my colleagues may mention that in their presentations as we go ahead. So I think what's really important for us today is to think about how we use data to monitor and how we use data to hold ourselves accountable to the implementation of the CRPD. And really just to stress the point that collecting data is not something that we do just because it's a good thing to do, but that it has to be aimed towards something that's concrete and something that is going to change or transform the lives of persons with disabilities. But let me stop here and take this opportunity to welcome the Secretary of State of the Norwegian Ministry of Children and Equality, Kai Morten Tering. And I have to really apologize. I've been practicing the names, but they are very difficult. So I hope I didn't completely butcher it, but please, sir.
Almost.
Almost.
Dear participants, we greatly appreciate the opportunity to host this important side event regarding statistics for monitoring the implementation of the CRPD and SDGs in the Nordic region. This side event is important due to several factors that I will briefly touch upon in my opening. Firstly, Statistics is an important tool for monitoring the living conditions of people with disabilities, and thereby also the implementation of the CRPD on a national level. For example, we know that people with disabilities in a lesser extent than the general population are in employment in the Nordic region. Number counts for us as policymakers. Secondly, there is a demand for harmonized and comparable statistics concerning persons with disabilities in all countries. A number is not necessarily meaningful in itself. It gives us insight when we are able to compare numbers. Therefore, we are working together in the Nordic region to find ways to compare the situation for persons with disabilities across our national borders. In the Nordic region, we have had a strong emphasis on including organizations of persons with disabilities when using statistics to monitor the situation. In this context, we are very pleased to host this event where we will get important insights from government bodies and NGOs. In today's seminar, several connected issues are discussed. For example, to what extent can statistics be used in a meaningful way in the implementation and reporting cycles of the Convention and the 2030 Agenda? How can statistics be harmonized internationally in order to achieve comparable statistics and further push for change? Are there other, more meaningful ways of measuring and monitoring? I hope you all will have a fruitful session. Thank you.
Thank you very much, Secretary. The way we're going to proceed this afternoon is, or this evening rather, is to go through the list of speakers. And I've asked everybody to stick to their time, and then we will hopefully open up for some questions and take it from there. So without further ado, I would like to ask Hanne Stig Andersen from the Ministry of Children and Social Affairs from Denmark to take the floor.
Well, thank you very much, Charlotte, and thank you for organizing this side event on this very important issue. In Denmark, we have a broad range of measures that are currently being done to use and develop statistics with regards to monitoring the social development goals as well as related national development goals. Today, I would like to describe how we use goal indicators to monitor national developments on the UN Convention on the rights of persons with disabilities, and how we monitor national political goals for people with disabilities. And lastly, I will also touch upon how we follow up on the SDGs. A key issue that I would like to stress is that if at all possible, we should try to break down development goals on the local level so that local governments can develop and prioritize the measures and interventions that work. The change we want happens on the local level in interaction with the citizen. The Danish Institute for Human Rights has identified 10 goal statistical outcome indicators to measure the progress of the implementation of the CRPD in Denmark. The main purpose of these indicators is to generate change and stimulate action. Statistical indicators have the potential of becoming goals for policymaking. The goal indicators are a set of 10 statistical outcome indicators which compare the situation of persons with and without disabilities, in relation to 10 key thematic areas of the UN Convention on the Rights of Persons with Disabilities. These indicators have been developed through an inclusive process between relevant national stakeholders, including national ministries, state authorities, and a broad range of disability organizations. The work on the goal indicators in Denmark is currently a phase where the municipalities are being presented to indicators on the local level. An important part of this exercise is then to give the municipalities suggestions on how to react and work with their status on the indicators. Where the goal indicators are only being measured by a survey every 4th year, the Ministry of Children and Social Affairs are also working on continuously improve yearly indicators on all people that are receiving social interventions in Denmark. This work opens for a broad range of research, analysis, and key figures. One recent development is that 1 year ago, the Danish government set 10 goals for social mobility, where people with disability were among the target groups. The aim of the social goals is to give direction and greater impetus to social policy under the headline, more people in the labor force and fewer marginalized people. Everyone must have the possibility of living an independent life. Thus, the goals are based on the premise that all marginalized people have the potential to progress and to take control of their own lives. Hereby, the goals should enable national as well as local government to provide support that works for each person. The result being that initiatives that work and have a documented effect are more widely used, so that more people receive support that makes a difference. The social goals will also form the main basis for our prioritization of, for example, the national social funds, to extend the use of effective methods. Too few persons with disabilities are in employment or education. That was the realization behind the goals for persons with disabilities. Many persons with disabilities are already a part of the labor force, and still more should have the opportunity to join them. However, progress in this respect has come to a halt, particularly for those with severe disabilities. Therefore, the government set the goal that more people receiving social service interventions due to reduced physical or mental capacity should enter into education or employment. The goal is geared towards the approximately 43,000 people receiving a social service intervention due to reduced physical or mental capacity. Social service intervention must also be designed such that more persons with disabilities have the opportunity to utilize their resources. This is best achieved if the intervention is based on actual knowledge of what works. The social goals can only be used to monitor the progress of social interventions if measurable data is available. Goals have therefore been defined for areas in which reliable data already exist or is readily obtainable. Close monitoring of interventions, also on the local level, is dependent on better data, and the Ministry of Children and Social Affairs is making a concentrated effort to improve data so that the progress of those receiving compensatory intervention for a disability can be regularly monitored. The status regarding the social goals will be presented on an annual social policy report, the first of which was published last year, and the next one will be published next week. Furthermore, the government of Denmark has an ongoing dialogue with local government Denmark and the individual municipalities on the local status of the progress with the social goals. I will also, if time permits, do I have 1 minute more? Okay. Also comment on the Danish handling of the follow-up on the SDGs. In doing that, we want to engage different actors and stakeholders in fulfilling the goals, both public and private, local, regional, and national. On March 31st of 2017, the Danish government launched the government's action plan for the fulfillment of the social development goals. The action plan is the Danish government's national follow-up plan and additional to the central UN follow-up. The action plan contains 37 objectives. Each objective has 2 sub-indicators. In addition to these 37 objectives, every new Danish bill or provision will be subject to an impact assessment relating to its contribution to the SDGs. Once a year, the Danish government will send a progress report regarding the action plan to the Danish Parliament, and every 4th year, the government will present a status report and review also to the Danish Parliament. But of course, the end result is not the monitoring in itself. The goal is to change the lives for people with disabilities for the better. Pursuit of the social goals depends upon different sectors and authorities working together and arriving at joint solutions. The municipalities have the primary responsibility for social interventions, but it is a responsibility of the state to provide the best possible framework for such interventions. Thus, the monitoring is pushing an important agenda for effective methods gathered from and shared between municipality, regions, and other organizations with experience of particularly promising practices, along with the collaboration with the knowledge base from other countries and from the world of research. Thank you very much.
Thank you very much, Hanne. Our next speaker is Evelina Penhinen. Say that again? Perhinen.
Very good, actually.
Trenchapo. And Evelina is from the Ministry of Welfare and Health from Finland. Over to you.
Thank you. I know I should have taken my husband's surname, which is much easier to pronounce. Okay, I'm going to tell you a little bit about the Finnish situation concerning indicators and data about the rights of persons with disabilities. It was very nice to hear the Danish experience about this issue. We have still quite a long way to go compared to our Danish colleagues, I think. But we have already have studied this and especially starting thinking what this means. As you probably all know, we have quite recently ratified the CRPD only a year ago, 10th of June 2016. So this year has really been about setting up the structures for implementation and monitoring the convention. For example, we have set up the coordination mechanism, the advisory board for the rights of persons with disabilities, which has started its operation in the beginning of this year. And the task for this mechanism is to coordinate the implementation of the convention within the government together with the organizations for the persons with disabilities. And it replaced the Disability Council, National Disability Council, which existed before this advisory board, which is now a government body. So we are really bringing the different sectors together to think how to proceed now with the implementation of the convention. We also have the independent mechanism set in place with the Human Rights Institution and the Parliamentary Ombudsman. So now it's really about how we cooperate, how we bring different actors together to think about what kind of data we need. We also have started to think about our first report, which is due a year from now. And of course, making that report requires lots of thinking about what kind of information, what kind of data we have, and what data we don't have. And so this will be a very interesting process. A little bit about the statistics situation in Finland concerning persons with disabilities. We have a national public authority, Statistics Finland, which is responsible for producing information for the reporting of the UNCRPD. They are also responsible for the European Union statistics, EU, SILC, etc. But what we have maybe a little bit of a problem in Finland is that we don't have really specific disability statistics. We don't have aggregated data concerning persons with disabilities. The statistics that we have are linked to the benefits that the persons with disabilities gets, all the services mostly. And actually our legal system is such that because information concerning disability is very sensitive information, and it's not really allowed to gather information and build registers of persons with disabilities in Finland unless there's a very good grounds for that. So we have to think about this and see what kind of data we can actually collect. In addition to the Statistics Finland, we have other key actors when it comes to gathering data and information concerning persons with disabilities and their rights. We have a national social insurance institution, Kela, which is responsible for the social benefits, disability benefits, for example, and also some sorts of rehabilitation provided for persons with disabilities. And then we have the National Institute for Health and Welfare that gathers different kind of information and statistics concerning disability services, social services, health services. So these are the main operators: Statistics Finland, National Social Insurance Institution, and National Institute for Health and Welfare. Then, of course, we have also the the implementation of the 2030 Agenda for Sustainable Development, and the Prime Minister's Office have given its publication this year about how to proceed with this. And there's some disability-related actions there, like, for example, significantly increase the chances of persons with partial work ability to find employment and remain at work. As we all know, in Nordic countries, employment of persons with disabilities is very low, too low, and we really need to work for that. And there's one researcher in Finland who said that the biggest human rights problem in Finland when it comes to the persons with disabilities, it's the employment situation, the lack of getting into the open labor market. And then the second action there is identify the most vulnerable groups in society and take account of their special needs and opportunities for participation. But what we really need to do now is to take a look at the existing collection of sustainable development indicators and update them to ensure that they really meet the follow-up requirements of society's commitment to sustainable development and the national implementation, and also the requirements of the CRPD. So we have quite a lot of work to do with this as well, and I think we can learn from our Nordic neighbors when it comes to this as well. But now when we are starting to think about the indicators, about the information, I think the most important question is that what do we want to know about disability? Not just start gathering information and so, but really think through what do we want to know and what are the requirements of CRPD. We have lots of different sources of information in Finland. We have population surveys through which we gather information concerning all population, concerning their health, social situation, children going to school, etc. And there we can add disability special questions. Then we have, of course, data on services and benefits. As I already said, we have organizations who gather information concerning those. We have lots of data on human rights, for example, from the Ministry of Justice, and also the Equality Ombudsman gathers this kind of information. For example, they just launched some months ago a survey about discrimination, and unfortunately persons with disabilities were the group of persons facing most discrimination in many areas in Finland. So that was not a very good result that we got, so we need to do something about that. Then, of course, European Union gathers information. We have Nordic countries, and then Agenda 2030. And then we have also some special surveys that are made, but I think we also will need more of those. But we have to think through all this palette that we have and see what kind of information we have, what do we don't have, and what kind of indicators can we really create. So as you can see from my speech, the indicator work and preparations for the first UNCRPD report are only just starting in Finland. So we are in the beginning of it, but of course we have done lots of thinking already to get ready to this situation. And what we are going to do is to anchor this indicator work to the work of the Advisory Board for the Rights of Persons with Disabilities, so our coordination mechanism. And we are going to establish an expert group under the Advisory Board for the development of the indicators and the data collection. And so there we are going to get the people from the Statistics Finland, from the National Institute for Health and Welfare, and the Social Insurance Institution, etc. So the best experts, national experts, to think this through. And also, I think we can learn lots from other Nordic countries, what has already been done in Denmark, in Sweden, in Norway, because you, of course, ratified before us. Sometimes it's good to be the last. So how much time do you have left? 1, okay. I have some examples here. For example, the health examination survey, which was a very large population survey that was made some years ago. And there was also questions about how people saw their ability to function, to manage in life situations. Did they have problems, for example, with seeing, hearing, walking, taking stairs, remembering or concentrating? And according to this population survey, age and gender-adjusted prevalence of disability was 12.6% in Finland. And compared to basic population, persons with disabilities were more likely to be elderly men, not in a relationship, and had smaller size of the family. So they were not in such good situation as the rest of the population. So we can gather information from all sorts of different ways, but this is something that I think we need to take a big picture of, and that's what we are starting to do. Thank you.
Great, thank you very much. So our next speaker is Born Lesher Newland, and he's from the Directorate for Children, Youth and Family Affairs from Norway.
And where I work is at a government agency who is responsible for working with equality and non-discrimination. And in addition to working with disability and accessibility and universal design, we also work with discrimination based on the basis of gender, sexual orientation, and ethnicity. Norway ratified the CRPD in 2013 and did our first report in 2015. And the issue of statistics and indicators was an important topic both in the government report, the shadow report, and also the civil society report, and has been also something we've worked quite a bit with since. In Norway, the social model for disability is commonly agreed upon, and we use now a very social and relational understanding of disability. And when we try to understand and improve the situation for people with disabilities, we have focused a lot on how social and physical barriers affect the living conditions of the population. And having this kind of living conditions approach to dealing with the lives of people with disability has been a Norwegian tradition of working with this field for decades now. However, it has also shown, and it's been commented on, that we might need to get better ways of, for instance, measure discrimination and inclusion. Because these are issues that doesn't always get as much visibility with the living conditions approach to dealing with the lives of people with disability. The government has a responsibility to have this updated knowledge about the status and development for the living conditions of the population, and also to use this information to see if we're heading in the right directions, and to use this knowledge to formulate new policies and measures. And we've seen that this is especially important in relation to the living conditions of people who face stronger and more resilient barriers, and thereby are more in jeopardy of having bad living conditions. We use a quite broad definition of living conditions, so we do include in the discrimination, universal design, and also resources in number of areas such as education, labor, leisure, health, etc. And the idea is to look at not only living conditions per se, but also see how people are able to translate living conditions into good quality of life. We have gone about it a little bit differently than Denmark. We have also looked into using indicators and defining key indicators, but we ended up focusing more on using statistics and analysis of those in quite a large area of things to get an understanding of how indicators how the living conditions are for people with disabilities. But although that's our approach, we have also seen that this is an area where there is a general lack of robust and strong data. So we need often to rely on other forms of knowledge, for instance, qualitative research, survey data, and quite often we face the shortcoming that we can rarely compare the results we find to the rest of the population. We also don't know if the sample in the research we deal with is representative or can get generalized from, but it often is the best we can have, and that's what we work from. But we do need both statistics and these other research in combination in order to get the overall picture of how it is to live with a disability in Norway today. We also see that a challenge is that the data and knowledge has been fragmented. It's spread out in many sectors of society and in government, and it makes it challenging also for an agency like ours to keep track of the overall conditions for people with disabilities. So this was very much the starting point when we started working more systematically with this in relation to the first report of the Norway to the CRPD. And it was also important for us to go about this in dialogue with civil society actors and also researchers. And what we ended up developing was a web-based resource which presents status and developments regarding the situations of people with disabilities in Norway going back a few years and also monitoring into the future. And this was launched in 2015, and we are currently, it's mainly data on a national level, but we are also currently trying to create a tool which can present data also down to the municipal level, because we also need to see what are the local challenges and see also how data can be used for developing local policy. And we have identified several important things when working for this. For instance, we see that it's a very big challenge in relation to the implementation of the CRPD, but also in the SDGs, to have this complete statistics about living conditions, and also that there are still huge knowledge gaps and we do still lack data. In order to also get legitimacy in the data we present, the cooperation with civil society has been crucial, both in the starting points, but also when we use the data. It's been, we created working groups that had both researchers and civil society as part of it. And by doing that, we hoped that the choices we made had also the support from the people that this affects. But we also think that it is important not only to give legitimacy to the data, but also that it can be used as a tool for NGOs and civil society in their work. So that it gives a stronger foundation and legitimacy when civil society, for instance, can make claims and work to promote the situation of their members of their organizations. Lastly, I thought I could also say something about some challenges that we haven't solved and we see that we need to work further with. And one thing is, of course, the issue of confidentiality and stigma. We've had, especially when dealing with people with learning disabilities or intellectual disability, the fact of how do you collect data in a good way and with the support of the people in question. And the issue of stigma is, of course, a question that comes up in all research and statistical gatherings with vulnerable groups, but it's important to keep in mind, and it's an issue that needs to be the part of every decision along the way. It's also been a focus in the Norwegian work to see, do we gather data or choose statistics or indicators based on existing data, or do we look into what are good indicators to describe people's lives and then see where do we lack data and work to develop it? The last often sounds the most ideal, but it also can be costly. It can have challenges such as Finland presented as well, and it puts us often in a bit of a tricky position. What do you choose? And then it's the issue of intersectionality, which also requires big data sets to be able to not only break down on different types of disabilities, but also include a gender perspective. If you even want to break it down on ethnicity or sexual orientation and gender identity, it's things that we see we need to also work further on. We recently did a research project looking into how to include a gender perspective, and one of the surprising finds we did was that, because I think at least I assumed that the finding would be that we do not include a perspective of women enough, but what it actually found was that when gender is included, it's only a focus on women. So what we really lack is a focus on men with disabilities, where we have very, very little knowledge. Either it's no gender perspective or it's a focus on women. So working further on how to include more issues in the research is important for more grounds of discrimination also than disability. Lastly, I just want to say that it's very important, like also my colleague from Finland says, to learn from each other's experiences. We're very happy that there's a Nordic project ongoing on how we can both collaborate and learn from each other in terms of working with the statistics on disability. And it's going to be very interesting to see where that takes us, since it's still an ongoing project. And I think what the State Secretary mentioned in his introduction is important in the terms of that for politicians, numbers count, and what counts more. So to continuously have an effort on trying to get better data and data that has legitimacy is something we need to focus on. And it's a work that I don't think a government can do alone. It needs to be done as a collective effort. So I'm very happy that we can have also a dialogue later that includes civil society.
Great, thank you very much. So we've had Denmark, we've had Finland, we've had Norway, now we go to Sweden, and for Sweden we'll have Malin Ekman Alden, and Malin is from the Agency for Participation in Sweden. Malin?
Very much. Right. Yes, I represent the Agency for Participation, which is a government agency responsible of supporting the government in implementing the disability policy. And the government of Sweden very recently presented a new framework for disability policy to the parliament that the parliament will be dealing with this autumn. And in this framework, it is very the convention, the CRPD is really forming the base for the whole policy in a very clear way. Also, the SDGs is a part of the framework. And it's also, you can say, it's a reconfirmation of the cross-sectorial approach to disability, which Sweden have used since year 2000. So this is a very strong statement from the government that will also affect the agency's way of working or even develop it, maybe you would say. In Sweden, obviously, there is a lot of statistics. We are a welfare state with a lot of welfare system, a broad public welfare system, and that would also mean that you would have a lot of data going on. However, however, it will not always approach disability in a sufficient way. There are many reasons for that. I think my colleagues from other countries have described quite a few of the different aspects. Could be legal things, could be also that in Sweden it's also very important that you are avoiding to register on different grounds, which is an important thing. That would also mean that you would not know. Well, you could not sort people out and so on. So there are different ways. However, we have a national statistic agency who have the main responsibility and are also the main provider now for the reporting to the SDGs. They are collecting all kinds of data. They are also doing public surveys of different kinds, different age groups. There is also a public health survey. I think the public surveys has been one of the key basis for catching data on disability, as that is an opportunity. They are asking very broadly about people's lives, and it's an opportunity to ask people a number of questions, also making it possible to identify people with disabilities. So that has maybe been one of our key sources in collecting data on the situation of persons with disability in Sweden. Different government agencies in Sweden are also having responsibility of data collection in their sector. Could be labor market, could be transport, and so on. So it's in some sectors disability is possible to identify, in some sectors not, depending. We also have a number of monitoring governmental bodies that are doing monitoring of our different, could be welfare system, could be transport system, and so on. And they would also collect important data on how things are implemented in the society. The Agency for Participation have two key missions from the government. One is to monitor the living conditions of persons with disabilities in comparison with other citizens of the country. Other one is to monitor how the disability perspective is introduced and implemented in different sectors of the society. And the agency has, in the form we have now, and also earlier in other kind of structures, been working on this for quite a few years. I think we learned quite a lot from this work. We tried to base the monitoring both on living conditions and the disability perspective on statistics and data. However, I think what we have found is that that doesn't necessarily, in a very good way, describe actually the situation of people on the ground. And why is that? Well, one reason is obviously that there is a lack of data in certain areas. In Sweden, for instance, in the education field, we know there are a lot of challenges for children with disabilities. However, the data are very few. Just as one example, I think another thing is that people with disabilities is a very heterogeneous group. It's in the way of we're using the kind of definition that is introduced in the CRPD, and that would also mean the disability group is a very broad group. And obviously there are great differences within the group in living conditions. And obviously some disability groups are very small, and if you're looking at public surveys, they are very, very difficult to catch. Because there are too few, and I mean there are limitations in the source you have, and so on. There are also groups like people with intellectual disabilities or maybe psychiatric disabilities that are very hard to catch. Maybe not because of the numbers, but because you don't reach them and they don't have the opportunity to answer in a appropriate way. So there are a number of problems, and we have since quite a few years presented annual reports on the development in Sweden, and that would show a clear differences between people with disabilities in an aggregated setting in comparison with other parts of other people in the society. However, if you go into the numbers that you can show on aggregated, and you would look at like if you're, for instance, looking at a group of persons with intellectual disabilities, you would show that you would find that the figures that we are presenting aggregated it's much too high if you're looking at employment rate and so on. Then it's actually the situation for these people. So we have now in the agency are working quite hard on looking how can we actually improve the things we have been doing. And we are still working on the system, and I think it will take some time to finalize. We will present a report this year, and what we are thinking is that the data, as we can have them, will be a very important base for the monitoring and the follow-up. But it has to be other sources also, and I think my colleagues have described that very well. I think there are different things that needs to be done. First of all, I think it's important to understand what kind of data do you want and what are you going to use them for. I think we have been collecting a lot of data but never used them, because if you don't use them, analyze them, they are not really very useful, and it's hard to understand also for policymakers. Other thing is that a lot of the answers on, if you're looking at living conditions and so on, is actually with the target group itself. You have to involve people with disabilities, and you have to find methodology that is making this possible. It should not be single stories, but it should be more on a more structural level. And we are looking at different panel opportunities, for instance, where people can actually, in a frequent way, being asked questions in different fields and answer. But we're also looking at things like groups where you can, for instance, enable people with intellectual disabilities to speak and have the opportunity to speak for themselves. So we are really looking at a system that will provide different opportunities to catch the situation. So that is what we're doing now. In the SDG discussion, the government is very ambitious in Sweden. They are. It's been a lot of focus actually on teaching and the society and making awareness around the SDG. And the next step will obviously be trying to transfer them and understand them from a Swedish context. We don't want a situation in Sweden that we should just confirm that as a rich country will just be top notch on each goal, but really understand that they are meaning something in our context. And that would also mean that all different sectors of society will be now involved in actually understanding and transforming this into concrete goals. Exactly how the structure will be done in this way is not decided yet. There are some suggestions in the government office. And disability is obviously one one part of this. I think Sweden is presenting its first report on the SDGs now in July here to the UN. I think it will be very poor in disability indicators and structures because of how data is collecting, but there will be continuous work on that, and we are looking at our work in the agency and what we're doing around the disability policy as one very important impact. Obviously, the Agency for Statistics will also work on this because they are obliged to actually talk on disability on aggregated level. All countries are, so they need to actually solve. I think maybe the work we will work very much together. Trying to do this. I think for the Swedish government, in ratifying the CRPD, it was very important to say that this is actually adding to the policy we have, not creating a separate system, but trying actually to make the CRPD mean something on the national level, being a base for the national policy. And I think with the new policy government have introduced, they've taken a further step in that. But that means that we haven't created a separate monitoring system for the CRPD, but it should be part of our national monitoring. And hopefully the CRPD committee will find that enough. I think they are expecting a lot of statistics from countries. I'm sure we will be criticized next report because we will not be able to provide it in all levels of society. But I think, we have to work, and I think we are actually anyway on a reasonable path that will hopefully give information that will mean something that will be good for policies, but also good for people and that have a disability, and that will be a great tool for both municipalities and up to government level. And last thing, what we are really looking at the agency and from the government mission is that you cannot only talk about the problems, identify and analyze them, but you also have to provide the next step. How are you going to deal with them? So that is also part of the system which we're working hard on. Thank you.
So thank you very much. And now we're going to pivot to a dialogue on statistics as a resource for governments and disability organizations. And I'm absolutely thrilled to introduce my friend and comrade, Kalle Konkola. And Kalle is with the Threshold Foundation from Finland. So Kalle, you have the floor.
Thank you, comrade. I belong to the group that I'm data critical. I'm not critical because the data is, of course, it's very important, but what kind of data we have and why we are collecting and what purposes. Like last year, I was making a report to the government about the disability services, and we very well know how much money disabled use from the budget for transportation, how much for personal assistance. We know exactly how expensive we are. But we don't know how expensive it is to run the administration. We don't know how much it is to cost that the government asks every year about 100,000 medical statements for nothing. Because people don't, when you have a disability, 99.9% you don't change. Not better at least, maybe sometimes worse. But we use millions of money for doctor statements that we don't need, just because to control and to show. That's amazing that this kind of data I tried to find out, but it was not possible to find it. It was an estimation, but it was millions about the money which was organized other way could have been used for services and not for the administration. I have nothing against administration, but to do work for nothing, that's not sensible. And I think that one reason is that the data we collect in Finland, it's one day somebody has decided we collect this data and nobody has thought why we are doing it. Then we collect it every year and nobody's reading it. Maybe in Teho, in the what's that in English, social and Health Institute. They are reading it now and then, but basically it's work for nothing. And I have followed this international debate on this long time, and like in very often in the developing cooperation, the argument is that we don't know the numbers, so we cannot start doing. And I have tried to say, there are enough disabled people, don't worry. You don't have so much money that you can solve all the problems of disabled people in the world, so that one day you put too much money because there are no disabled people anymore. There are more than we need, in fact. But that's like one issue. And then the argument is that because we don't know, we don't do anything. We first have to know how many disabled we have in this and that country and what kind of disability they have. And that's why we are waiting. Like I have been following this at least 25 years, and every year we heard the same argument. And then if this issue has been on the table so long, why nothing has happened? Why we are still talking the same way that what should we know and what we shouldn't know? I think one important issue is also that we should have a data that help disabled people and not against them. I think that's also the UN convention's like background idea, that the convention is for the disabled, and we need to have right indicators. If we have wrong indicators, we are doing wrong things, and it's not a technical issue to make a decide indicator where you find data. That easily happens. Okay, we have this data, we make this indicator. We should think what we need to know to measure what's happening for the life of disabled people. And the one fact is that we don't know how people are living. We don't know the careers of disabled people. Like I have been wondering that people with the same disability, they have a different career of their life. Some people are lying in their bed the whole of their life, almost, and other people with the same disability, they are in New York, in the meeting talking about statistics. I don't know which one is better. But anyway, it's quite boring to be always in the bed. But we don't know why this happens. Why the carries? Why some people go to school? Why some people go to universities? Why some people don't go? And why some people work and why some people don't work when they have a disability. And this kind of information and data we should have, and find the indicators which hinders to equal opportunities and possibilities to live equally in the society. And maybe we should start thinking when we are making the indicators from the beginning, so that what we want to know, what we want to measure during the years, so that when we start, we are not starting to measure wrong things. Like in Finland, it's interesting how many disabled people we have in Finland, because the best statistic in this is tax statistics. Because in Finland you can still have a tax reduction if you can prove that you have a disability. And you can be sure that that's a statistics where there are most disabled people. Because people want to show that they have a disability, because they get €100 a year tax reduction. Not much, but enough for the work. So these are important issues, and I think that from looking from the organization side, DPO side, we don't have enough capacity at the moment to really fully participate on this discussion and debate. I have a degree in university in statistics, so I know what is estimation of the life length. It will be too short anyway. Don't worry. But we don't have the knowledge how to handle this issue, and that's why the dialogue is so difficult at the moment. But on the other hand, if we are looking now for not only 2030, that's too short time, but we should think about maybe 50, 100 years forward, we need a new kind of approach. Maybe not collect so much data, but try to collect the right data to measure and so that measure where are the improvements. It's easily governments. I'm not blaming any government because they all are the same. that they like data that shows that they are well, they are good. Like you listen here, every government is doing so well, and if you listen the reports in the big hall, that world is fine, no problems, at least in our country. Thank you.
Our next speaker is Sindre Borke, and Sindre is from the Norwegian Federation of Organizations of Disabled People from Norway. Over to you.
Thank you. We may use different words sometimes, but with the same ambitions. We need a society where persons with disabilities and chronic diseases have opportunities like everyone else to take an active role and part in all aspects of their own lives. And to accomplish that, we need documentation of important structures and cases in society. We need statistics. Statistics needs a population definitions. Who have disabilities? Who have chronic diseases? What connections are there between diseases and disabilities? What about disabilities that are real but not accepted or recognized by the person in case? Statistics Norway describes living conditions in 7 different areas for persons with disabilities, usually as one population. Different surveys have different definitions of disability, leaving it to respondents to decide whether they have disabilities or not. Problematic, but still, in the basic, maybe the real bottom line for us is how do persons value their own situation? I have not a thorough knowledge of Washington Group's work, but as I understand it, the question sets are made to standardize definitions. The group itself and others reminds us that it's not perfect, but a step on the road. The question sets opens, as I see them, for monitoring different types of disabilities. This is useful because having problems with self-care reduces different ability compared to hearing problems. To enhance the political work seen from the DPO side, this splitting up would be important. It is difficult to identify who has reduced ability, even more difficult to register abuses or discriminations in a stringent way. We have to try, but to some extent we have to accept that not all that counts can be counted. Sometimes we must accept proxy variables, also a difficult topic. The Norwegian statistical system is good, but we see possibilities and we have wishes for expansions. Methodological work is needed in how to monitor abuses and discriminations. I see more problems than solutions at the moment. Active use of Washington Group question sets will come, I hope. Separate statistics on different disabilities will follow, I hope. Designing new repeated surveys, perhaps. And of course, the difficult question on use of existing and new registers. That could be both administrative and statistical registers, and even medical registers. But again, this is the real difficult topic. Norwegian statistics are good. I think that building relevant and high-quality statistics can and must be supported by active analytical use, including scientific approaches. What about funding analytical work in NGOs? That could also give more qualified user representations in developing statistics. Okay. A couple of questions as conclusions. Do statistics describe the right problems, or is it like easy to get more than important to get? And do political discussions build on statistics available, or vice versa? Thank you.
Thank you very much. And last but not least, Maria Johansson from the Equal Unique Sweden.
Thank you very much. It's been so interesting to listen to everyone, and there are so many aspects in this, so many ways you need to approach this issue to find the right way forward. Even if we know about the reality, we have learned the hard way that we need to put data, statistics on this reality to be able to reach forward and to be able to put focus on the issue to reach the society, to reach the politicians, to reach media, and to create a public opinion. That's the fact. As Marlene said, we have a lot of data and statistics in Sweden, but we also have to make sure to take action when we don't have data. That cannot be an excuse not to do anything, not to start. We also have statistics not being used, so to say. One example that I think is common for all the Nordic countries is when it comes to employment. When we have known for quite many years now the situation, but not very much happens. It's also a question about what we are measuring and how we measure. The other day, I read a report telling that, well, it's not a problem with accessibility to schools in Sweden. They are quite accessible, all of them. That was news to me. I really want to know how they measured when they came to that result. Another thing that is close to this we are talking about now is when it comes to policy review, we need to make sure to have a disability perspective. It's very, very important. If we keep going on without that, we are pushing the future ahead of us, and that's a problem. We have an example from Sweden right now. There is a policy review about equal health without a disability perspective, even though we know that health is a big problem when it comes to persons with disability. We also need to know more about why things are like they are and how, for instance, like how do persons with disability get affected by inaccessibility, or how are they affected by accessibility? We have to have more research on the situation of life that maybe not always is so easy to put figures on, but to understand what's behind. It's also important that when we compare statistics and data, it's done between persons with disability and persons without disability in the same country. And as Björn said earlier, we have to take this 1 or many steps further. We cannot just look at persons with disability and persons without disability. We have to have a gender perspective, an age perspective. We have to find how is it for girls with disability, boys with disability, and how does the sexual orientation affect this. But in the end, a lot like Kalle said, even if we have the data, how do we get this data to really make us change and do the changes that's needed? We cannot just rely, we need more than the figures. We need to use them to change the future. Yeah, I'll stop there. Thank you.
So I think that was a really, really rich discussion, and I think it was really interesting because I think there are a lot of commonalities that came from the various countries, but they're also very different. What I'd like to do is open up for questions, for discussion, and let's use this as a learning event and share some knowledge. So any ideas, thoughts, comments, reflections? If you could just say who you are, that would also be really helpful. Thank you.
I'm Fatima from Ministry of Social and Family Development, Singapore, right? So we are new to the scene as well, right? And we've been trying to collect data. So the Privacy Act, the sensitivity around disabilities all pose an issue. But I'm thinking more like instead of having things like a registry for persons with disabilities, and we're not headed that way, we probably do a database of persons with disabilities, which is to collect administrative data that resides within different agencies for starters, whether it be hospitals, schools, birthplaces, when they register, and so on, and to put together a profile of what's going to happen. Basically, what we need is from the time they're born, right, we need to kind of plan for when they're going into adulthood. So we use administrative data for the most part in planning. But what we are more interested to find out is how are the policies and initiatives that we have come out with impact the man on the street, that person with disability. So very often it's about bringing that quality of life type of indicators into play with statistics and data on how many persons are benefiting from schemes and programs. And also, for different groups of people, it's different kind of things. Those who are able to go into employment, it's about how they can live life more independently. For those in care, it will be the quality of life type of indicators. So this has to be combined. That's the social aspect of it and the disability aspect of it to the numbers that we have. So it's actually drawing a balance between these two that we grapple with. Yeah.
Any more questions from the floor? Yes, and then I'll take two questions and then ask the panel if they have any reflections on the questions posed. Go ahead.
Hello, yes, thank you. I have a quick question. So I know that there are different issues like about collecting data and also about the privacy issue about asking the person if they have disability and also whether or not the person themselves will limit if they have disability. But I was just wondering if, and I realize that this is probably a new frontier or something that haven't really been explored yet, but have any of your countries ever thought to use or have considered using digital information or digital data or even like big data in some way, shape, or form and to pull out the different information about person with disabilities or about maybe the patterns or what, especially in situation for accessibility, which which transportation or which area of the public transportation is used more often because there's a larger population of person with disability in that area, or just in the different context. I'm sorry? Oh, I'm sorry. My name is Sandra Lopez.
Firstly, a word of appreciation for the panel for starting this discussion. Secondly, a little bit of background to my question, which follows next. I represent the Dutch government. In Holland, we're working on an implementation plan for the CRPD, and it's a joint initiative of state level, municipalities, corporate actors, and of course people with disabilities themselves, represented in what is called in Holland the Alliance. We're working on an implementation plan. We recently sent it to the Dutch Parliament, and we're now starting the implementation program. As you might know, Holland ratified the CRPD last summer, last conference. My question, I recognize the ambivalence in finding the right data very much. In Holland, we see two kind of initiatives. I'm going to name two concrete examples. For example, one city in Holland is really looking into quantitative data about the lives of people with disabilities. In reference to Singapore, what we see on the streets, they're trying to look into that. Another city, I'm going to call it by name, it's called Maastricht in Holland, is doing qualitative research. They have a large focus group of people with disabilities, and they ask them how do they experience day-to-day life, and what kind of things are they stumbling upon in daily life. So you have the qualitative approach and the quantitative approach. My question to the panel is, how do you combine them? How do you make a synergy?
Okay, great. That was a very clear question. So we've got three questions, three sets of questions. The first one looking at, from Fatima from Nepal, looking at kind of issues related to confidentiality, privacy acts, discussion, thoughts, reflections on a database for persons with disabilities. Is this something that you're thinking about? Is this something that maybe Nepal shouldn't do? Some thoughts on that. Some ideas around quality of life. From Sandra, the point around self-identification and the possibility of using digital data to collect disaggregated disability data. And then from the Dutch representative, he didn't tell us his name. Implementation plan, we know you've got one, but what's the balance there between qualitative and quantitative data? And or how do you merge the two? How do you synergize these two very different types of data sets? So to my very esteemed and knowledgeable panelists, any thoughts, any reflections? Han.
Well, one reflection about whether or not to register disability. I think my colleagues from Norway and Finland also touched upon it, and I think we have a similar approach that we don't do it. We don't register people by their disability, neither in Denmark. What we can do, and of course also being a welfare state with a lot of statistical or registered data, we can combine like what interventions are given to certain people, and they have their social security number, and we combine that with the registered data we have in the employment sector, education center, health sector, and that way we can gain knowledge about their situation. But at the end of the day, we are struggling, Kalle, very much. It's not a perfect situation. We are struggling. But at the end of the day, what methods are actually working in order to make the person's everyday life better and to ensure progress for the individual? And that's what we are struggling with, and that's what we are trying to use our focus on statistics and data to gain more knowledge about that. So we use the money we have, a lot of money, for the right methods that actually have an impact for the person in question.
about digital. I'm not quite sure I will answer your question, but we have. I think we all want to know actually how is measures impacting on people's lives. I think that is really what we are looking for, and it's very difficult, and some countries are really huge. But anyway, it's quite simple, but. One thing we've used as a very simple digital tool is what I think I was talking a little about. We call it a panel, where we are continuously during the year inviting people, as many as possible, to join. And by joining the panel, you will have the opportunity to ask a number of questions in a special. Could be on education or transport, different subjects, and from that we got. It's a qualitative method, you can say, but we could get quite interesting information that can actually be a base to go further to understand better in different things. And that is one way of actually trying to find people directly. I mean, how do you feel as a person with disability that things are affecting, and what would make things better, and so on. So that's the way. And I suppose in a country like Nepal, maybe people are not so computerized all over the country, I would guess, and that you would, but you could think in the same way. Can you find ways of actually asking people? That is quite good. And that's quite an important thing, because I think, as I said, that you need to combine, as you are saying, quantitative and qualitative data to actually get a picture. But I think also it's really important when you talk about statistics that you really try also to think, I mean, what is important to know, but also to understand what is behind the statistics. You have to understand the results. And that is maybe I think the idea about big data and trying profiles and understanding different structures is really important to do that kind of analysis. And I think that is a very important part of the whole work, actually, to use it and understand. And I think that needs research, because we couldn't do. There are a lot of legal obstacles in doing cross running of data, at least in Sweden, but research has more freedom. So there is a combination of different actors needing to really understand. And maybe that would also make us even better to collect right data after, when understanding the structures and what is actually impacting. Thank you.
I'm going to take another round of questions, and I have an indication from the lady here, and then from Trina, and anybody else? Can't see. Okay, please go ahead.
I'm Christy Weir from Special Olympics, and we support the rights of people with intellectual disabilities. And I know a lot of the research that we look at and a lot of the research that we do, we see that there is a huge gap in research around intellectual disability versus physical disability or any other disability. And so I have two questions for anyone on the panel that would like to answer. One, looking at hearing that we need to bring different sectors together to determine what type of data that we need. One, who are those sectors that you think as a start would be the best way forward, because there's so much to target, number one. Number two, when you look at determining the indicators for success on measurement, where do we start? Because I think, when we go to our partners and we go, we're raising funds to further awareness for people with intellectual disability, we have to show how we've moved the needle and how we've made impact. And I'm sure all of you in this room probably have to do the same thing. So going to a lot of these sessions to learn what data is out there and how we track it makes us do our jobs better. So just understanding how we can get to that. Hard questions, I know, but I'm interested. Thank you.
Thank you. My name is Trina Riis Hansen from the Atlas Alliance Norwegian Disability and Development Organizations. Thank you for very interesting presentations. I was very interested in the Danish presentation, and that to learn that you have made an action plan for SDG implementation. So I'm really interested to know if you have considered or if you have used the Washington Group set of questions in that plan. And also that you have been working with a Danish well-known Center for Human Rights, which I think is really, really good. So that is my question, or if the other Nordic countries have considered using the Washington Group questions. And I just wanted to comment on Nepal, because our organizations have supported a living conditions study in Nepal with the organization that Sindre Børke represents and the Norwegian Research Institute. So we are happy to share, and we know that the Washington Group set of questions has been used in that study. So we would absolutely share if you would like to hear more about that. Thanks.
Well, I have to admit by now that I'm not an expert in this. I'm a policy officer, really. So I would have to go back and ask exactly what has been done. But if you give me your card, I will get back to you. And when I get back to Copenhagen, to be exactly sure of if the questions are included in the action plan and how we've done it.
Any comments on this side of the table? Sindre, any final comments? Kalle, any comments?
I want to raise one issue.
Please go ahead.
There are different issues here that we started to discuss about the collection of the data, but now there's also a question about how we connect the data to individuals. And I'm like worried in Finland we are now combining the social and healthcare, and all the data will be together, and who can read that? And okay, we can say that civil servants are honest, but even the policemen are reading the wrong data. And they, just in Finland, I think it was 20 policemen went to the court because they were reading the wrong grade data. And if we cannot trust police, can we trust the medical or social authorities? And that's like what we want that other people know about our life. Okay, it's very important that if I go to the operation that the doctor knows my blood pressure, that's fine. But the doctor should not know about my life as such. That's like one important issue that we should not remember when we talk about the data. And there's a difference. Now we are speaking more about the Nordic approach. And we are well-developed countries, and we have a lot of information, but in New York we have also to think this globally. And globally we don't know so much about the information, and we don't know how reliable the information is. Not like Finland has put quite much money to the, that's an example, quite much money to the special education and education in Ethiopia. And when I met somebody from the Ministry of Education in Ethiopia, he said that 96% of the disabled people have no education. I don't know, should I trust on this information or maybe World Bank knows that better than we, but anyway. Anyway, it shows that the money during the last 15 years are misused. I don't say legally misused, but it has not benefited the disabled people to be in the education as it was planned 15 years ago. Because still great majority of the children with disabilities are outside of the education. So these are important issues. And one more example is that European Union is having first own project on disability. And I was shocked when I heard how much money they used to find out how many disabled people are in 11 countries. I think it was almost 1/3 of the 6 million, so that's a wrong approach. I understand we need more details if we put 100 million. That's a different scale. So we should also think about the scale what we are using so that we don't do misinvestment.
Thanks, Kalle. Maria, any comments? Any last thoughts?
I agree in a lot of what Kalle says. It's very important that not the wrong things are registered and that you can connect it to the person, of course. And I think the model with the panel that Malin talked about is a good way to collect information.
Marlene, any last thoughts?
I'm thinking about what Kalle says. I think we are living in a very digitalized world, and there are. And when we talk about disability, we are a very broad group, and I think you have to be. Sometimes you are very you are rushing to collect as much information and data as possible, but you're forgetting a lot of ethical issues, and I think there are. I think that is very important. I think it's really good when you are thinking now in Nepal that you are actually considering this, because I think we know that we live in a world where people with disabilities are not fully respected as citizens, and a lot of discrimination is going on. And also in data collection that will show, and because the medical model is still very strong. And if you are looking at people with disabilities more like an object and not as a human being, there are a lot of risks. So I think actually, and I think for some groups, at least in Sweden, we experience people maybe that cannot really approve on how the data is used, because they maybe have a cognitive problem like dementia, or people with psychiatric disabilities that know that because of the stigma of the disability, there are many groups that would really have a lot of questions around this. And I think that is also important to carry with you in this strong effort actually to know as much as possible of the impact. And I really think, I mean, how much data you would ever get, the real answer is actually with the person that is affected by the different things, and I think we have to remember that. And that's the whole dynamic with us as government and official persons, and the collaboration with the civil society. It's really, I mean, when you talk about data, that is quite practical and it's needed. Thank you.
Very much agree with what Malin just said. Something I've also been sitting and thinking about is that, you know, we focus a lot on the how to study people with disabilities, how they feel included, how they feel in society. But we also need to measure how inclusive are our societies. What are society's attitudes? For instance, discrimination as an example. We know that asking people whether or not they've experienced discrimination is a very bad measure. But checking actually how our employers, what is attitudes in societies, are much better ways of figuring out how inclusive societies are. And I think to remind ourselves that we do not only need to focus on the group itself, but also open our eyes, maybe sometimes turn our back and look at society and not only at the population in question. And these are things we also need to think about when also looking at statistics and indicators, in addition to panels and other things that has been mentioned. So I think that's just the last thing I wanted to add.
Yeah, discussion has been very good here, and I've got lots of ideas. I think we have to keep it very clear in our minds why we are gathering this information and data, and of course, is to implement the convention. And I'm more convinced after this debate that less is better than more. That we have to really think what kind of information we need and how we gather it. And in this, we really need to work with the DPOs, because they know the situation. Through them we can reach also the difficult groups that you mentioned that we don't have enough information of. And here I think we need new methods and new way of cooperating together.
So I really hope that this was as informative to you as it was to me, because I found it extremely informative. And I'm sorry, Christy, we didn't answer your questions, but you live in Washington, and I'm sure we can find a way to figure that out. But there are just a couple of quick reflections that I would like to conclude with. And just to pick up on the first comment made by Kai Morten, that numbers count, and what is counted gets counted. And I think that that's really an important piece to remember. I think it was pretty much mentioned in each one of the presentations that it's not perfect. It is very much work in progress. There are a lot of different types of data sets of data. So we've got administrative data, we've got survey data, we've got census data, we've got human rights data. That was very refreshing to hear that that's happening. We've got panel data. So there are different types of data. I also heard and was very excited by the notion of how do we ensure that we can look at collecting data at municipal or at local government level, because I think that that's often a place where we don't see data collected. We see it either at national or subnational level. So, so I think that that's an important piece. A critical issue is to involve persons with disabilities throughout the processes, and I think that that came across from many of the presenters. And then I think something for us to ponder over and reflect, when we go back to our respective places is how do we reach some of the most difficult groups to reach? And that, I think, really requires some strategic thinking. It requires some engagement with those groups to begin to understand how we do that. I think a few speakers spoke about the importance of intersectionality and how do we drill down. We have multiple identities. We may be in multiple data sets. And how does that all come together? I also heard the need to build capacity for better data collection. And that's an issue certainly in the Nordics, but given where the World Bank sits, that's a huge issue in terms of the countries that we serve. I also heard that we need to pivot from data overload to more useful data, and that data needs to be a lot more focused on how it impacts and transforms people's lives, and less so on just collecting data for collecting data's sake. And I think related to that there was also the point around a lot of unused data. So you've got, data banks or data sets that haven't been analyzed, and even if they have been analyzed, that has never really led to the next piece, which is, policy and then hopefully implementation of various services. I think there were some interesting perspectives. The Finnish one comes back to my mind around how you don't, legally you can't ask for disability-specific data. And that's an interesting challenge, I think. I think that's an interesting interpretation just in terms of the convention. And then one point that really resonates with me, both as a person with a disability and somebody who, thinks a lot about data, is that data doesn't always describe the situation on the ground, right? And for me, that's really an important piece. There's often a disconnect in terms of the data that we have, and I think Kalle was making that point very strongly. And the real lived lives of persons with disabilities, and constantly thinking about persons with disabilities as a heterogeneous group, and therefore my lived experience may be very different from somebody else's lived experience, and so data it's in and of itself doesn't necessarily give us the granularity that we're looking for when we're thinking about including people. There was also lots of important points, but the one point that I found really important was how do we look at data to really begin to address the issue of exclusion, or how do we measure exclusion? And that's something that certainly was coming up this morning in the opening session. And then a lot of discussion around living conditions of persons with disabilities, thinking not just about data in its typical form, but talking about data in terms of universal design. How are we building those databases? So for me, this has been an extremely, extremely rich conversation, and I am just very grateful that you asked me to moderate this. Again, I hope it's been as useful to you as it has been to me. And I really hope that this is the beginning of a yearly discussion that the Nordics will have on disability in the COSPs that come up annually. So thank you all very much for your time. We've got a few minutes left, but it is almost 8 o'clock, and I will take the liberty of being the moderator and bring this event to a close. And thank you so much.